Hello, I'm Andrew Wilson. I'm the presenter of the Osteopathic Masterclass series. I've been in private practice as an osteopath for over 30 years. In that time, I estimate I've personally done over 100,000 treatments, and in my clinic, we've done over 300,000 treatments. I've worked with and mentored more than 50 osteopaths over that time, and I've become very experienced at working with different types of patients and different practitioners. Working in a busy practice, I soon developed a long list of patients with chronic symptoms, and I've had a special interest in developing treatment models for those more challenging cases. I began to realize the principles and applications of osteopathic technique, while often helpful, did need to be augmented with other approaches. My search for new information took me to ergonomic conferences, where they looked closely at epidemiology of musculoskeletal disorders and modifications to the way people lived and worked to try and reduce the incidence and assist the rehabilitation. I explored these links in 2 textbooks I wrote for the general public. These were published worldwide in the mid-1990s, Are You Sitting Comfortably? And The Complete Guide to Good Posture. In the late 1990s, I began to offer courses to osteopaths in management of chronic injuries and clinical ergonomics. This was a 20-hour program, and I ran it in New Zealand, I ran it in England, and also in Prague. In the early 2000s, I felt I'd developed my ideas about musculoskeletal injury management sufficiently to seek a larger platform, and I wrote a textbook. Effective Management of Musculoskeletal Injury, a Clinical Ergonomics Approach to Prevention, Treatment and Rehabilitation. This was published by Churchill Livingstone around 2002 and received worldwide acclaim. In fact, I've been approached by Churchill Livingstone to write a 2nd edition. About 5 years ago, I upgraded my seminar program, and I ran it as a 4-day program which I titled the Osteopathic Masterclasses. This is based on 2 weekend seminars, and I've delivered these about a dozen times in New Zealand, but also in England, Scotland, Greece, and with programs coming up in Australia and Germany. The aim of the masterclasses is to draw on my extensive clinical and practice management experience and combine it with an evidence-based approach. I continue to attend evidence-based research seminars such as PRIMUS, Prevention of Musculoskeletal Injuries, and the World Congress on Low Back and Pelvic Pain. Both of these are triannually, and I've been attending them for 15 to 20 years. I try and absorb the most recent evidence and combine it with my practical experience to create management models and practical tools suitable for the busy osteopath to incorporate in their clinic. Day 1 of the Osteopathic Masterclass explores treatment planning, patient management and practice management. Many of the successes of manual therapy are due not just to the therapy, but the way we interact, educate and communicate with our patients. It also explores the treatment and management approach for more chronic or difficult cases, how to recognise them and when to adapt your treatment approach accordingly. It also gives valuable tips on how to build a successful practice and a busy patient list. Day 2 of the masterclass explores low back and pelvic pain. It takes an evidence-based approach to acute, chronic and complex low back pain. It explores prevention, manual therapy and patient management, including exercise rehabilitation. It covers recognizing and managing disc problems, what's the most effective treatment and at what point to consider specialist referral or surgery. With the increasing age profile of society, we need management models for advanced degenerative change, for spinal stenosis and degenerative instability, and we look at the evidence-based approach for managing these. The available research on low back pain is reasonably definitive now, what works and how much it works for different types of low back pain. And now research has begun to focus on subgrouping, which clinical signs become treatment predictors and which intervention combinations work best for which clinical signs. Day 2 explores 2 methods of subgrouping low back pain so you can optimize the outcomes for your patients. Day 3 covers the evidence-based approach to neck and shoulder pain. It includes whiplash, chronic pain. It includes the treatment of complications from neck pain such as headaches, vertigo, visual disturbances and cervical neuralgias. Day 2 also covers the risks and side effects of manual therapy, including minor, moderate or severe complications. It asks the vital questions. What is the real evidence of the risk for vertebral artery injury and what can we do to avoid that risk. Day 4 explores the clinical ergonomics approach. It looks at work-related epidemiology of musculoskeletal injury and the risk factors associated with them in both developing acute and developing chronic form. Injury can often be seen as a mismatch between the person and their environment, and sometimes the most important manipulation is to the environment. In this masterclass, we complete a detailed study on office and computer-related posture and ergonomics, and there's a practical component where each person is expected to do 3 workplace assessments using the forms and the systems I've developed over the years. The seminars are packed with useful information. They're heavily referenced, so you can complete further study. In fact, I see them as a blueprint for successful osteopathic practice. Many of the tools were developed from my years of training osteopathic associates. There's also an optional distance learning component to allow attendees some practical experience to reinforce the learning tools they've come across. The courses, they've met a need for high quality continuous professional development. And you can find more information on our website and read some of the feedback we get from our satisfied attendees. The website you'll find at oaw.net.nz. That's oaw.net.nz. I hope to see you soon. Thank you.